How do doctors visualize lymphedema, lymphatic flow? Imagine trying to see inside your body to understand how fluid moves through your lymphatic system. Doctors have developed several safe and effective ways to do this, especially for patients with breast cancer who might develop lymphedema after treatment. These imaging techniques help visualize the flow of lymph and identify any blockages or abnormalities. One of the most detailed methods is magnetic resonance imaging, or MRI. MRI uses strong magnetic fields and radio waves to create detailed three-dimensional pictures of tissues. When doctors want to see lymphatic vessels specifically, they often perform lymphangiography. This involves injecting a special contrast agent called gadolinium into the spaces between fingers or toes. The contrast helps highlight the lymphatic vessels on the MRI images, showing if they are dilated, blocked, or leaking. Sometimes, MRI can be done without contrast using special sequences that detect fluid buildup. These images help doctors understand the extent of lymphedema and plan treatments like surgery. Ultrasound is another tool doctors use. It's a non-invasive technique that uses high-frequency sound waves to produce images of tissues. Ultrasound can show the thickness of the skin and tissues affected by lymphedema and can visualize superficial lymphatic vessels and nearby veins. In some cases, contrast-enhanced ultrasound is used, where a tiny amount of contrast agent is injected to improve visualization of lymph nodes and vessels. Ultrasound is quick and safe but depends on the skill of the operator and has limited depth penetration. Lymphoscintigraphy is a specialized nuclear medicine test. It involves injecting a small amount of radioactive tracer near the affected area. A special camera then tracks the movement of this tracer through the lymphatic system. This technique helps assess how well lymph flows and whether there are blockages or backflow. While it doesn't provide detailed images of the anatomy, it is very useful for understanding lymphatic function. In some cases, doctors perform interventional procedures like intranodal lymphangiography. Here, a tiny needle is guided into a lymph node under imaging, and contrast dye is injected directly. This allows real-time visualization of lymph flow and helps locate leaks or obstructions. More advanced techniques include accessing the thoracic duct through veins or the neck, which can be used for diagnosis or treatment. These procedures give a three-dimensional view of the lymphatic system and help tailor treatments. While these imaging techniques provide visual insights, doctors also use measurements like limb circumference, optical limb volume assessments, and electrical impedance to monitor swelling over time. These tools help track how well treatments are working and guide ongoing care. In the context of breast cancer, where lymphatic damage from surgery or radiation can cause lymphedema, these imaging methods are vital. They help doctors understand the severity and specific location of lymphatic issues, guiding personalized strategies to reduce swelling and improve quality of life. Remember, each person's situation is unique, so always consult healthcare professionals for advice tailored to your needs. These techniques are safe, non-invasive, and part of comprehensive care to help manage this challenging side effect.